Hello, my name is Marla, and I will be your moderator for this workshop. Welcome to Neuropathy, what it is and how to treat it. It is my pleasure to introduce to you today's speaker, Ms. Aimee Chappell. Ms. Chappell is a board-certified nurse practitioner who specializes in multiple myeloma and plasma cell disorders at Lombardi Comprehensive Cancer Center at Medstar Georgetown University. In addition to caring for patients in the hospital setting, Ms. Chappell leads a regional monthly support group for patients and caregivers dealing with plasma cell disorders. She has focused her career on malignant hematology and has worked with leukemia, lymphoma, and multiple myeloma and bone marrow transplant patients at multiple academic centers. Please join me in welcoming Aimee Chappell.
Everybody, I'm very happy to be here, so thank you for having me. Today we're going to be talking about neuropathy, what it is, and how to treat it. So we'll start with our objectives of today's talk. First and foremost, defining what peripheral neuropathy is. Then we'll talk about some causes of peripheral neuropathy. There's a lot of them, but we'll review a few of them. We'll talk about risk factors for developing neuropathy as well as contributing causes that can make neuropathy worse. We'll talk about symptoms of the different kinds of peripheral neuropathy, testing for peripheral neuropathy, and finally, treating neuropathy. And within treating neuropathy, there are two primary categories that we need to address, and one is treating the underlying cause, while the other one is symptom management. So starting with defining what peripheral neuropathy is, our nervous system is our command center of our body and tells our body, it comes from the brain, it originates in the brain, and it tells our body how to move, how to feel, and sensations. There are two main parts of our nervous system, and that would be our central nervous system, which would be the brain and the spinal cord, and then our peripheral nervous system. The nerves in our body control our sensation and movement in our body, and neuropathy is damage to these peripheral nerves. And there's many different ways that you can have damage to these nerves. It depends on the underlying cause. To what actually happens to these nerves. There are actually more than 100 different kinds or types of peripheral neuropathy, which we'll go over a few of those, 100. Initially, when peripheral neuropathy presents, it typically affects the long nerves, so it's felt as primarily in the hands or feet, and typically as a pins and needles sensation or numbness, but we'll talk more about that in the symptoms. The causes of peripheral neuropathy. Unfortunately, there are many different causes. There's even a suggestion that there are hereditary causes as well. Diabetes is the number one cause of peripheral neuropathy. Typically, it's uncontrolled diabetes. Alcohol consumption, HIV-induced neuropathy, nutritional imbalances, specifically B12 deficiency, can cause neuropathy. Carpal tunnel is a common neuropathy that we'll talk a little bit more about. It's the most common type of neuropathy that's called entrapment neuropathy, and I'll explain why in a little bit. Also, chemotherapy-induced neuropathies that we'll discuss. And then GVHD-associated peripheral neuropathy. Also, underlying cancer can be a cause of peripheral neuropathy. The most common cancers would be multiple myeloma, amyloidosis, and a lymphoma called Waldenstrom's macroglobulinemia. So let's focus primarily on the chemotherapy-induced neuropathies and the GVH-associated neuropathy. Starting with the chemotherapy-induced peripheral neuropathy, there are certain chemotherapies toxic, meaning it's quite toxic to the nervous system. 30 to 40% of people that are on these neurotoxic chemotherapies can develop peripheral neuropathy. So some of these examples are bortezomib, which is also known as Velcade, thalidomide, which is an oral agent used, and it's an old drug used less common now, but it still is used occasionally. There's a family of drugs called taxanes, or Taxol is the most common one. And there's a family called vinca alkaloids, or vincristine. So unfortunately, it used to be thought that older agents were the biggest culprit for causing neuropathy, but newer agents are doing it as well. Typically, there's not a way to prevent neuropathy associated with chemotherapy, but you can help by eliminating your other risk factors. The damage to the nerves is what causes this neuropathy from chemotherapy induced. It's usually sensory neuropathy, which we'll talk a little bit more about the different types, but there are different types, and sensory is usually the most common when it's chemotherapy induced. So graft-versus-host induced neuropathy is very rare, but it can be associated with the transplants that you receive from a donor, or the allo transplants. It only occurs in about 0.6 to 6.1% of patients after these allo transplants. And there are different causes for this. First, you have to eliminate that it's not an infectious cause, which your healthcare provider would do with blood work. If it actually is GVH induced, it typically occurs about 5.5 months after transplant, and it is more common in patients that have long-term immunosuppressant use. These immunosuppressants would be steroids like prednisone, cyclosporin, tacrolimus, and the different drugs are associated with different kinds of neuropathy. So risk factors for developing neuropathy. We talked a little bit about diabetes and how that's the most common cause for neuropathy. If you do have uncontrolled diabetes, and then excessive alcohol use can put you at risk. In addition to that, long-term use of immunosuppressive medications, like we were just talking about with GVHD. Additionally, age. The older you are, the more at risk you are for developing peripheral neuropathy. A smoking history can put you at risk. If you have baseline neuropathy, if from diabetes or kidney disease, and then are exposed to neurotoxic chemotherapies, you are more at risk for worsening neuropathy. And then kidney impairment or liver impairment. Either one can put you at risk for having toxic levels of different kinds of substances in your bloodstream, which can then damage nerve tissue and lead to worsening or a diagnosis of neuropathy. So symptoms of peripheral neuropathy depend on the type of nerve affected. So we have 3 different primary kinds of symptoms that can occur. One is sensory, another is motor, and third is autonomic. So starting with your sensory nervous system, if these nerves are the ones affected, you're going to notice numbness and tingling. People describe it as pins and needles sensation in their fingers or their toes at first, and then it can advance. Pain in these extremities. You can have decreased or increased sensations and temperature changes. So a lot of people will say their toes always feel freezing cold. People sometimes explain this as electric sensations going up or down their feet or their hands. Or something feels like something's in their shoe when there isn't, and they're constantly checking to make sure they're not stepping on anything. It can feel like you're walking on pebbles. So for the motor nervous system, or if the motor nerves are affected, you're going to notice more gait imbalance, or the way you walk, weakness in your muscles, muscle cramping or muscle loss. People can describe it as their leg feels very heavy or their arm feels heavy, and it's just really this weakness of their muscles from the nerve damage. And then the autonomic nerves. The autonomic system is a part of the peripheral nervous system, and it regulates the involuntary processes in our blood, so our heart rate, our blood pressure, our digestion. The symptoms of this would be lightheadedness if your blood pressure is dropping suddenly, impaired food digestion, erectile dysfunction as well. Testing for peripheral neuropathy. Everything starts with a good physical exam. Light touch is used. Usually we'll touch people's feet and have them close their eyes and say, tell me when you feel me touching your foot and which foot am I touching. As well as vibration testing with a tuning fork. We'll ask you to tell us when the vibration starts as well as when it stops. Strength testing. We'll have you squeeze our hands or lift up your leg up against resistance with our arms. Check the reflexes of the extremity and do a walking test where we have you walk up and down a hallway, make sure you're not don't have any imbalance or an odd gait. In addition to this, a lot of blood tests are done. First and foremost, to check for vitamin deficiencies, to look for a cause. Your kidney, liver function is important to check. Any signs of infection, because some infections can cause nerve issues, and immune system levels. More testing for peripheral neuropathy is very common to undergo nerve conduction tests and EMGs. Nerve conduction tests are done with little pieces of tape that are put on the skin, and they're measuring the strength and speed of these nerves. So they're actually sending a little electric shocks through the stickers that are put on your skin. And then the EMG, or the electromyography, is very common. You have little tiny pins put in, and they'll measure the electric nerve activity to distinguish between muscle issues and nerve disorders. That test tends to be a little more painful than the nerve conduction test and can make the muscles quite sore afterwards. The EMG detects if the muscle is working in response to the nerve sending a stimuli, whereas the nerve conduction test detects a problem with the actual nerve. There is an option for a nerve biopsy, which is extremely helpful in gathering information on any cause for the peripheral neuropathy, but it also carries risks, including damaging that nerve even more so. So it's not used too frequently. Then there's also a skin biopsy, which is a more benign test and doesn't cause as much of a risk. It's mostly helpful for sensory neuropathy or small fiber neuropathy, which may not be picked up on those other nerve tests we talked about, the EMG and the nerve conduction tests. Next are radiology imaging for peripheral neuropathy, which is a very common first step. So, for example, if you're having neuropathy symptoms in your arm, you want to make sure that in your neck there aren't any nerves being compressed. Nerves can be compressed for many reasons, arthritis, herniated disc. If you have a type of cancer that can cause bone damage or masses, they would look for that as well. Similarly, if you have neuropathy occurring in the lower extremity, they may look at your pelvis or at your lower spine, your lumbar spine, to see if there's any compressed nerves there. So managing peripheral neuropathy. So two categories that we look at. One is treating the underlying cause, and the other one is symptom management. It's important to keep in mind that treatment varies greatly depending on the cause of the neuropathy, the location of the neuropathy, the symptoms themselves, how severe the symptoms are, and your medical history. The best treatment for anything is really prevention, which is very hard with neuropathy, particularly those caused by chemotherapy or GVHD. But like we talked about, we can minimize our risk factors. So treating the underlying cause of peripheral neuropathy, if possible, we always want to treat the underlying cause of every issue. If it's drug-induced or chemotherapy-induced, consider stopping or dose reducing the drug after discussing with your health care team, of course. Some of these chemotherapies are very dose dependent, meaning that if we lower the dose, the risk for neuropathy lessens significantly. So it's extremely important that the first sign of neuropathy, you share that information with your healthcare team, because the quicker they can address it and make any changes, the better for you for long term. If it's a vitamin deficiency, you treat with vitamin supplements such as B12. If it's induced by the cancer or disease, is the disease under control? And if it is, there may be another cause for your neuropathy. If it's diabetes induced because your diabetes is uncontrolled, that needs to have better, tighter control with your insulin or other medications. So for treating underlying cause, let's talk a little bit about carpal tunnel, because I would say half the patients that come to me with peripheral neuropathy symptoms, it ends up being carpal tunnel. So carpal tunnel is pretty common. It occurs in 3 to 6% of the general population. It's compression of the median nerve at the wrist. So when you flex your wrist, the nerve is compressed and then can result in numbness and tingling in the fingers and hand and wrist. People think that it's mostly would be occurring in one hand, but actually there's some studies that show up to 50% of patients have it bilaterally, which means in both hands. The cause can be many things, like all of neuropathy. It can be hereditary. It can be trauma to that extremity, repetitive motion. It can be induced by a cancer, such as multiple myeloma, which actually can increase your risk for carpal tunnel. And the best thing to do for this to start out is try wearing a wrist brace, especially at night, because people tend to move their wrists and keep them at flexed positions while they sleep. So the wrist brace actually keeps it straight to prevent that compression of the nerve. So a lot of providers will have you try to wear a wrist brace and see if that improves anything. And if so, then carpal tunnel might be the issue. Also for treatment is over-the-counter pain medication or anti-inflammatory medication, eliminating the cause. So if it is a repetitive motion, from my history, I had it after scooping deep freezer ice cream for an ice cream shop through college. So stopping that eliminated the problem. And lastly is surgical intervention, which can be very helpful, and it's not a very invasive procedure. So symptom management gets a little trickier. We'll start with self-care. So if you are a smoker, stop smoking, because that can aggravate peripheral neuropathy. If you exercise, that can help strengthen the muscles, especially for motor neuropathy. Controlling diabetes and blood sugar levels, weight control and good eating habits. Supplements such as alpha-lipoic acid, B-complex, and acetyl L-carnitine. These supplements are tricky. They have a good amount of evidence backing them up that they are helpful. The problem is we don't know how long one should take them, the duration of how long that is needed, and the adequate dose. So it's difficult to give too many guidelines on that, but it has been shown to help many people. So moving on to medication, sensory neuropathy, and sensory is that the feeling, the sensation, and the numbness, tingling, the temperature changes. That can be hard to treat without medication, unfortunately. Many medications are available, not all are helpful. Antidepressants have been the newest agents that are used for peripheral neuropathy. Examples of this are duloxetine or nortriptyline. Antidepressants can help because they actually increase the brain's ability to prevent or stop the incoming pain signals, so they can help with those sensations and particularly pain. Anticonvulsants or epilepsy medications are used pretty commonly as well by neurologists. Examples of this are gabapentin and Lyrica. Unfortunately, these can make you tired and have side effects and can be difficult to drive when you're taking them and such. And then there's over-the-counter pain medication, which it can be helpful. Lastly, for severe symptoms, narcotics are at times advised. Topical treatment can be helpful. Lidocaine patches or gel, which are available over the counter, can kind of be a local anesthetic to that area. Capsaicin cream, which is a chili pepper extract. Some people really think that that is helpful. You can soak your feet in cool water, not ice water, but just cool water, or use Epsom salts. The non-pharmacologic symptom management, other things we can do for our peripheral neuropathy. Physical therapy can be very helpful for both motor and autonomic neuropathy. It can help, strengthen your muscles. It can help with your walk and your balance. It can help with endurance, which is important for all of us. It can also help with the automatic neuropathy. For example, if your blood pressure tends to drop, they can really help you learn how to move slowly to prevent that from happening. Occupational therapy can be helpful as well, just to find aids to assist, such as good braces. Sometimes with neuropathy, people can have trouble gripping things like a phone or typing on a computer, and occupational therapy can be really helpful for that. Other non-pharmacologic ideas for helping are, these are a little less backed up by evidence. There's evidence for all of these, but there's conflicting evidence, I'll say, for all of these. So one thing is cognitive behavioral therapy. Cognitive behavioral therapy you might have heard about for different things. Probably the most common thing that you hear about it for is back pain, which many people deal with back pain, unfortunately. So it's also called CBT, and it's a mindfulness strategy that basically helps train your brain to deal with those pain receptors. So the evidence is varying, but they do know that CBT is effective in general for pain syndromes. So the overall thought is that it could be helpful for peripheral neuropathy-induced pain. Acupuncture and massage as well, there's conflicting evidence. Some studies show that it's effective and some don't. So these might be a trial and error to see if it actually helps with your symptoms. Aids are important for peripheral neuropathy. Having orthopedic shoes or good, strong shoes with thick bottoms is important. Having a walker for gait imbalance, hand or foot braces are helpful as well. It's important to, if you're having a lot of numbness in your feet, it's important to have proper footwear to keep your feet safe. So on that note, good foot care is really important. Because your feet are numb, you can step on things and not even know that you have. You can injure your foot and not even know that there is a cut there or an injury there. You can have an infection on your foot and not realize it. So it's important to have very good sturdy shoes with hard bottoms so that you don't step on something that could damage your foot and not even realize it. It's important that you observe for injuries or skin breakdown at the site. You want to keep your feet dry to prevent too much moisture. And you want to wear shoes at all times. It's very easy to just stub your toes or injure. I've had people with pretty bad damage to their toes with that because they didn't realize that they hurt them. And I just wanted to say, a couple of things about what's next for peripheral neuropathy. Peripheral neuropathy is a frustrating symptom because it's not always treatable, which is difficult. There's a lot of work with clinical trials to change that. So the National Institute of Neurologic Disorders has funded a lot of different clinical trials, some of which are looking at gene testing for the hereditary impact of this. There are studies looking to prevent or treat neuropathy. There's studies looking at the different brain pathways to identify substances to block those signals. There's even studies looking at tissue engineering to develop new therapies for treatment. So there's a lot of hope in the future for this. And with that, I think we'll wrap up and address some questions.
Aimee, thank you for that wonderful presentation. We do have a number of questions here, so we will get to them. As a reminder, if you have a question, please type it into the chat box on the lower left-hand corner of your screen. The first question today is, I have been prescribed Dapsone as a post-transplant antimicrobial. Could that drug be responsible for my neuropathy?
So it's not a known frequent side effect for Dapsone. That said, I did look up the frequency of neuropathy in Dapsone, and it was noted on post-marketing data. So it has been reported by patients. It hasn't been reported enough that they have a percentage to allocate to that symptom, but it has been reported. So it's possible, but if it is, it would be extremely rare.
Thank you. Can compression socks help with neuropathy? And if so, what strength do you need to use?
So with compression stockings, the best thing to do is do the 15 to 20 millimeters of mercury compression. And you should never go higher than that, or I should say tighter than that, unless your healthcare provider recommends it. It can be helpful, if in case anybody doesn't know, compression stockings kind of compress your skin, and it's very helpful with any swelling or fluid retention that you get in your legs. So it can be helpful in terms of pain and the burning sensation. I don't think it's known to help the numbness of the feet. Some people complain with compression stockings that itself causes numbness as well. So.
Okay, good. Thank you for that. The next question is, how important are exercise and muscle tone in controlling neuropathy? And then the other part of the question is, what are the best types of exercise? Yoga versus weightlifting, running versus walking?
Yeah, that's a great question. So it's important in different ways. So it depends on what kind of neuropathy, first of all. If it's a motor neuropathy, it's extremely important to help strengthen those muscles. Additionally, we know that obesity is a contributing factor for neuropathy and can make it worse. So it is important just to have overall, good exercise routine. The type in that regard wouldn't matter as much, but you just want to make sure you're fit and getting, good exercise for your muscles.
Thank you. What vitamins do you look at in the blood test?
So they're looking at B12 specifically. B12 is a common cause for peripheral neuropathy, and it's a treatable one. So they're looking to make sure that you don't have a deficiency in B12 because they can treat it, which would help the neuropathy.
Okay, great. Is acupuncture helpful for foot neuropathy and back pain for feeling better in general following an autologous transplant?
So there's a lot of evidence that shows that acupuncture and other therapies that are similar to that are helpful for our overall health, especially when dealing with a cancer and treatment such as a transplant. There are several studies that show that it's helpful as well for peripheral neuropathy, including of the lower extremities. When they look at all of the studies, they weren't able to say that there was an overwhelming, improvement in symptoms, especially long term, to say that it's a helpful strategy. I think most providers would say it's not going to hurt you and it's worth trying because there are people that say it helps. I will say post-transplant or when you have a cancer, you should always check with your healthcare provider before starting acupuncture to make sure that it's safe for you.
Great, thank you. Can you talk more about using CBD in pain management for neuropathy?
Yeah, so CBD is very helpful for general pain syndromes. Similar to what we talked about with that cognitive behavioral therapy. We know CBD works for pain syndromes, so the presumption is that it would help with peripheral neuropathy-induced pain, but that hasn't been proven yet.
Okay. To be determined there. The next question
lots
is,
of work to do.
are all types of neuropathy treated the same? I have idiopathic neuropathy in my feet, possibly from a pinched nerve somewhere in my back. All tests are inconclusive, and I am 10 years post-transplant.
Yeah, so all signs point to that it's the pinched nerve causing that pain. So if you can't, fix the underlying cause, the actual pinched nerve, then you'd want to try all of these other strategies we talked about, such as physical therapy and the other symptom management things we talked about. In my experience with pinched nerves, physical therapy is the most effective strategy.
Great. Next question is, where can I find exercises for foot neuropathy?
That's a great question. I wish I could point you to an actual website, but I would have to, research some to make sure I find a dependable site first. So if you don't have a neurologist or a physical therapist that can point you in the right direction, I would ask your healthcare provider to look at that for you. There are a lot out there, but I wouldn't want to give a recommendation without, researching them first.
Thank you. Someone was referencing one of your slides, and they were asking, did you mention that carpal tunnel syndrome can be caused by neuropathy, or did they hear that wrong?
Yeah, no, and I don't know if that was when my voice was cutting out, but no, so neuropathy, carpal tunnel is a type of entrapment neuropathy, it's called, and it's because that nerve is being trapped by the movements of the wrist.
Okay, thank you for clarifying that.
Mhm.
What can you tell me about using polychromatic infrared therapy for neuropathy?
Yeah, I think that this is referencing the LED infrared therapy, which there is some evidence that it's helpful. The issue is that they did not see long-term effectiveness. They only saw short-term effectiveness with it, which for people dealing with neuropathy, that may be sufficient, right? Um, but I think the bottom line with that is that there's more work to be done to say how long or how frequent you need the therapy in order for it to be helpful.
Thank you. Is there any data on which drugs used for BMT patients are known to cause higher incidence of peripheral neuropathy?
The evidence shows that the immunosuppressants do that or increase the risk for peripheral neuropathy. So sirolimus, tacrolimus, prednisone, cyclosporin, all of those that suppress your immune system, which is important. So you don't stop those because of the risk for peripheral neuropathy. And remember, the risk is very, very small in these transplant population. But those are the drugs that are the most frequently seen with it.
Thank you. This question comes from a 33-year-old female with POEMS. She's 3 years post-transplant, and she has peripheral neuropathy and chronic muscle spasms 1 year out from transplant that has not yet been resolved. Does this happen post-transplant in patient? Her doctor suspects it is her nerves awakening.
So POEMS is tricky because some of the neuropathy associated with POEMS doesn't resolve, unfortunately. But if you're having new symptoms, everything else needs to be ruled out, right? So the compressed nerves through imaging, they need to do nerve conduction tests to make sure there's no other cause before saying that it's the POEMS. Typically, once POEMS is controlled after a transplant, you don't see worsening neuropathy. So you want to make sure there's not another cause. If it's just stable neuropathy that you've had since, being diagnosed, then it's probably just the POEMS, and unfortunately, all of that neuropathy does not go away.
Thank you. This is another vitamin question. How often should you check your vitamin levels? I was taking B complex and had a high level, which also causes neuropathy.
Yeah, so, most providers will only check the vitamin levels in a neuropathy every few months, like every 3 months. Some will do every 6 months. It's really dependent on the provider to what their preference is. But, you don't want to check it more frequent because you're not going to see enough fluctuation to check it more frequently than 3 months, every 3 months.
Okay. Next question is, how can I better treat my neuropathy so that I can sleep without pain?
That's a tricky one. Neuropathy can be a wide range, but it can be, subtle to almost debilitating. So I feel for you, and but I would look back at the slides because the symptom management that we talked about, those are the therapies that are available. And if it's impacting your sleep, many patients in that situation do require medication such as the antidepressants. And the antidepressants aren't used for depression. It's used to treat the actual symptoms associated with neuropathy.
Okay, this kind of tags onto the CBD question. How about THC for neuropathy?
Yeah, it's very similar to CBD. For THC, there's not much evidence out there for either, and there's a lot of work being done to study these more. But at this time, there's no guidelines as to how much, how frequent, how helpful it is because there haven't been enough studies yet.
Okay, thank you. How would you label neuropathy that comes and goes? It's not constant, but it does happen periodically.
And that's common with neuropathy. Neuropathy symptoms are not always a constant symptom, and they can come and go depending on the temperature, depending on movements in the body, and sometimes it doesn't have anything to do with either of those. It just can come and go. So in the medical side of things, we describe it as intermittent symptoms of your neuropathy. And it's treated the same as if it was there all the time.
Thanks. What about treatment with rebuilder to stimulate nerves?
I don't know much about that. I would say that you should talk to your neurologist about that, because I can't give any guidance on that.
Okay, thank you. I have not been wearing shoes since isolating with COVID and chemo treatment. My feet are now getting dry and cracking. Do you have any suggestions?
I don't know if you have neuropathy. If you do, I would recommend wearing shoes in the house too. But if you do not have neuropathy, just make sure that you are moisturizing really well with, the thick creams, or Vaseline is important. At the same time, you don't want your feet to be moist, and because it can create an environment for infection. So yes, cream, but try not to have them be wet, and put socks on or anything like that, and shoes on top of that.
Okay, thanks. Someone wants to know if there's any evidence of soaking your feet in apple cider vinegar that is helpful.
That's a good one. I haven't actually heard that one. Apple cider vinegar is used for a lot of things now, which is pretty cool. But I haven't heard that one for your feet. So I can't back that one up.
Yeah, apple cider is the thing, I think.
Yeah. Yeah.
Let's see. Are there any new breakthroughs in treating neuropathy from chemotherapy in the feet?
So I wish I could say there were. I think the biggest, excitement out there is the antidepressant use. I'm talking about that's on the market now. But there are a lot of trials right now that are really exciting. So if you have any interest, I always recommend checking out different clinical trials that are available. You can go to the clinicaltrials.gov and put in peripheral neuropathy and see what's available, because with those trials, we can then, develop more treatments available.
Thank you. Okay, this is kind of a long one here. This person is an AML post-transplant patient. They were dealing with some GVHD. They were on and off Jakafi, and they were having some problems. They were getting heated up, whether they were inside or outside. There were pins and needles feeling in their body from their head to their toe. She said it doesn't happen in the shower. Is this neuropathy, or could it be damage to my sweat glands from chemo? Have you heard of this?
So, yeah, that's a tough one. You can have damage to your sweat glands, but the pins and needles sensation sounds different. It's interesting that it happens in the whole body like that. I would definitely say that this person should probably discuss this with their healthcare provider, because you may want to have some nerve conduction tests done to see what exactly is going on with those nerves. Are they just hyperactive, or is there damage to them? I think you need some testing done.
Ah, that's good advice. Thank you. Next question. I just deleted it by accident. Besides the tingly, numb feelings I get in my fingers and toes, I get pain right on my nail beds. Is that neuropathy caused, and what treatment could help it? I lost all my nails during chemotherapy.
Yeah, that's difficult. because you can get so many skin and nail damage from the chemotherapies, which is separate. But the pain that you're describing does sound like neuropathy.
Thank you. This person is 9 years post-transplant, and they have carpal tunnel in both hands and had surgery and lost feeling in their fingers. They now have cramping, pain, and loss of strength in both hands. Where is it best to turn for diagnosis and treatment for something like this?
Wow, yeah, that's terrible. You definitely need to see a neurologist because you need to have some motor nerve testing, probably the EMG testing we talked about, in addition to the nerve conduction test, to see if there's motor nerve damage or what exactly is happening.
Thank you. This person asks, they have neuropathy right now. Is there going to be improvement over time, or does it get worse? Is there any sure answer?
So it depends on the cause to know if it's going to improve. So it varies greatly depending on, if you can eliminate the cause, and some of the causes, some of the chemotherapy-induced neuropathy does not go away, unfortunately.
Next question is, other than stretches, can you recommend anything else for muscle spasms?
So yeah, there are muscle relaxants that are helpful, but those have a lot of side effects. So you'd have to talk to your healthcare provider about those.
Someone wants to know, does Nervive help?
I don't know what Nervive. Oh, the cream maybe. I'm guessing they mean the cream. So I haven't had any of my patients use it successfully, so I can't back it up, but I also can't say it's not helpful. It may be helpful. You have to try it then.
Thank you. Next question is, I get cramping in my hands occasionally. Is it from overuse? This person crochets hats for cancer patients. Thank you. Or is it related to neuropathy? It gets better if I don't use them as much.
That's a great question, and thank you for crocheting hats. That's so nice. So that, it's tricky to say if that's neuropathy because if one of the most common places for us to get arthritis is in our hands, and that can cause cramping as well with overuse. So doing something fine like crocheting could just cause aggravation of arthritis. So you probably need an exam done by your healthcare provider, or your primary care provider might even be able to distinguish by doing an exam.
Thanks. Should I avoid wearing fingernail polish if I have finger neuropathy?
I have never been told by a neurologist that any of my patients can't wear nail polish by, for finger neuropathy. So I would say it's okay from my experience.
Okay, thank you. I keep accidentally deleting the questions. How do I eliminate diabetes as an underlying cause to my feet neuralgia after CAR T-cell therapy? My A1C just now spiked to 7.5 before the day 0 of CAR T.
Yeah, so that was going to be my question. Is it controlled or is it uncontrolled? So if it's uncontrolled diabetes, if your A1C just spiked, unfortunately it could be contributing. A lot of times we're not able to say 100% what the cause is, and many times it's multifactorial, meaning it's many things, not just one. It's a combination of things. So you may never be able to say for sure, but I would definitely say get those numbers under control.
Thank you. Is soaking feet for 30 minutes in warm water and Epsom salt effective for tingling in the feet and toes, which was caused by Velcade induction treatment, now 9 months post-transplant?
Yeah, I'm sorry to hear you have that. Yeah, so some people think that Epsom salts works really well. Other people say don't use the Epsom salts and instead use cool water every day. So it may be a trial and error to see which is more effective for you.
Okay, thank you. I started getting neurological tingling in my toes after BR chemo in 2016. This neuralgia and blood glucose has increased since, as I've had R-CHOP and now CAR T therapy. Are there any patient empowerment options that are available?
So I would say the most empowering thing for patients is knowledge, right? So educate yourself, and I would check out the clinicaltrials.gov and see what's out there, and because neuropathy can last a long time and it can really impact your quality of life too, unfortunately. So your situation is not unusual, unfortunately.
Okay, thank you. All right, this is a long one here. I had numbness in my feet initially from fractures from multiple myeloma. I developed some pain from Velcade in my feet and then worse after melphalan. My feet burned terribly after walking. The transplant doctor said it would go away, but it is still there. I am frustrated and sad. I don't want to take any more medication. I'm already on a morphine, extended release, and gabapentin. What do I do?
Yeah, I really feel for you. Unfortunately, Velcade is one of the most common drugs to cause peripheral neuropathy. And, melphalan is not, it's a very rare side effect from melphalan. So, I have a feeling it was actually just neuropathy still coming on from the Velcade because it can continue to get worse even when you're off of it those first couple of months, those first few months. Unfortunately, when it's from these chemotherapies, especially the Velcade one, it doesn't go away fully. That doesn't mean that there aren't strategies to make it better, which we talked about all of those earlier. I would suggest really going through those options that I discussed earlier and seeing if there's any that you haven't tried. I wish I could say there was, a cure for your situation, but I'm hopeful for the future that there will be.
Thank you. Someone wants to know if massage or manipulation with golf balls and tennis balls can be effective for foot and toe tingling.
Yeah, a lot of people think that massage of the site is very helpful, especially for the numbness. So yes, I would say try it and see if you're one of those people that thinks it's helpful.
There's a couple questions. I'm going to combine them. It's really just about the chances of the nerves recovering. Someone had they have peripheral neuropathy, and it was they had a transplant, and then there was chemo drugs, and they are doing PT 5 days a week, and they're still not feeling great. Is there any chance that their nerves will recover?
There is. And, it depends on the cause. So it depends on the cause of the neuropathy and to know and how much damage is done to the nerves to know if it will improve. But there are many neuropathies that do actually improve with time and therapy. So you're doing the physical therapy already. I would recommend trying to add one of the other strategies as well.
Thank you. Why do they continue to use Velcade as induction therapy when there are other drugs available?
That's a tough question. So in my practice, we don't use Velcade for that exact reason. But it is a really effective drug. And it's one of the older, more trustworthy drugs because it's been around for so long. So it's used very commonly. I think that the future may move away from that because this side effect can be so debilitating. So I agree with you.
Thank you. What is the evidence to help me decide whether to take alpha lipoic acid for neuropathy in my feet? One doctor recommended 600 milligrams a day. Another says there is insufficient evidence. Thank you for that pronunciation.
Yeah, they're both right. So there's some evidence, but it's insufficient to really guide how much and how frequent and how long to take these supplements. And it really depends on the person, probably. You know, some people are more willing, if they are out of options, they're more willing to try things, even if there's not enough evidence to say to do it. So, you know, you can always try it and stop it if you're not seeing any improvement.
Okay, thanks. And this is going to be our last question. With regards to acupuncture, is it okay to do if I'm still on tacrolimus 2 times a week? And someone mentioned trigger point massage. Is that a thing that is okay? I was not allowed to do deep tissue massage for a while at the beginning of my treatment.
Right. Great question. So that's why earlier when we were talking about acupuncture with another question I mentioned, always get your healthcare provider's approval first. There are, you know, some of these remedies are not benign. You know, they can cause problems. So you definitely need to get that one cleared by your healthcare team.
Okay, and on that note, we will have to say thank you very much on behalf of BMT Infonet and our partners. Thank you, Ms. Chappell, for your very helpful remarks, and thank you, the audience, for your excellent questions. Please enjoy the rest of the symposium.
Thank you, everybody.